Here now is Solutionaries.
Welcome to Solutionaries. I'm your host, Lewis Bolden. This is a show where we talk about hard things, problems that don't have a silver bullet or a single answer. We've looked at the stigma that comes with drug addiction and solutions to stop the deadly overdose crisis in the U.S. In March of 2023, the FDA approved Narcan, a nasal spray that reverses a drug overdose. Now, for a long time, many people saw this harm reduction approach as a support system for drug users. But others argue it is saving lives. The Solutionaries team takes a first-hand look at this approach in Virginia.
Just because someone uses drugs don't mean to count them out. That's somebody's son, daughter.
This is a serious crisis, and we can no longer afford to kind of put our head into the sands and pretend that this isn't happening.
I'd probably been drinking since I was 9 and using hardcore drugs since I was 11.
We've got to make the treatments and the connections to care easier to access than the dope. I mean, that's the bottom line.
Drug use continues to be an issue across the country, but one of the solutions is harm reduction. It can be a controversial topic. What is harm reduction? Harm reduction is an evidence-based approach that is critical to engaging with people who use drugs and equipping them with life-saving tools and information to create positive change in their lives and potentially save their lives. Some say it's enabling people to use drugs, but others, like you'll see in a couple of minutes, say harm reduction is saving people's lives and leading them to eventually get treatment for addiction. Like with anything, there are roadblocks and limitations.
So how have things been?
Good, it's hot.
It's really hot. Are you staying hydrated?
Staying hydrated.
I'm Courtney Downs. I'm a staff member at Virginia Harm Reduction Coalition. Have you been to another syringe exchange, like the drop-in center or anywhere?
I haven't.
Since your last?
No, I've just.
And I also used to be a registered nurse. Throughout my active using, I lost my nursing license and ended up homeless here in Roanoke. Anytime we can encourage anybody to go from injecting to smoking, it decreases overdoses, it decreases the risk of infections like endocarditis. I come from a background of domestic violence and trauma and mental illness. I'm a person in long-term recovery. I have 3 years and 8 months, something like that. Abstinence from all drugs and alcohol. I was hanging out with some people that were early participants of Virginia Harm Reduction Coalition, and even though I wasn't a direct participant, they Narcaned me with the Narcan that they received.
So this program saved your life?
Yeah, I wouldn't be here today without it.
The data is very, very clear. This saves people's money. This saves people's lives. And to me, there's no downside to harm reduction. We provide case management services, we provide HIV and Hep C testing and connection to treatment. We provide safer use supplies to stop the spread of HIV and hepatitis C, as well as prevent dangerous infections like endocarditis.
What are the results of harm reduction? How is it working here?
It's working really well. I mean, the data is very, very clear. Harm reduction in syringe services is an evidence-based solution that has been borne out over and over again. If you are in a member of a harm reduction program and are accessing services through a harm reduction program, you're 5 times more likely to enter substance use treatment.
We are packing kits. These are naloxone intermuscular kits. So we have syringes, naloxone vials. My name is Joe Bryson. I'm a volunteer here. Everything I see, the work being done is super important and saving lives every day and helping to put these folks on a path towards getting a little better.
You said you were going to get emotional. Why are you going to get emotional?
Yeah, because of the people on the staff here and the way they treat and respect folks in the participants in the program. It's just great. It's so much about respect and humility that any of us could be there, and how these people are Participants could be any of us.
I'm Beth Macy. I've been writing about the opioid crisis for more than a decade, including my 2 last books, Dope Sick and Raising Lazarus. I mean, the first time I really understood harm reduction, I was talking to this treatment provider in New York State, and he said, I was a heroin user in the 90s. I went into a needle exchange, and they said, how can I help you? And he said, I'm hungry. And they gave me a sandwich. And that sandwich led him to go back and eventually start using more safely, and eventually connected to care. He got his family back, he got his job back, he went back to school, he has a master's degree. He runs a recovery center in Jamestown, New York. There's this whole world existing just barely below the surface. You don't have to go very far to find it. That is full of these people living on the margins and using drugs. There's this whole economy around it. If you're waiting for somebody to hit bottom, yeah, but the bottom has a basement and the basement has a trapdoor. And in an era of fentanyl, the bottom is death. So that's why we've got to get to them before the fentanyl does. We've got to make the treatments and the connections to care easier to access than the dope. I mean, that's the bottom line.
Talk to me about those policies. Is it a regional, is it a state thing? I mean, it seems like there's a lot of barriers depending on where you live.
At the beginning of doing this research, I kept asking people like for that magic wand like solution, right? And certainly the federal government could do X, and then we began to work on that treatment gap. But what I learned was public health and the way we treat addiction is very much part of each community's basket of gifts. Until they do something to fix the fear of withdrawal and dope sickness, they're going to keep using. This idea that just putting people in jail might make the politicians look good because they can say, oh, look, see what we're doing about the opioid crisis? It just doesn't work.
Talk to me about the skepticism.
We believe that every single one of our participants has the potential to turn their life around, to become healthy and happy and connected into their communities, but they can't do that if they're dead. And so when people say that syringe programs are enabling, I completely understand where that comes from. I was raised with that same philosophy. What I say to those people is that a harm reductionist will never try to glorify the use of drugs or minimize the real harms associated with injection drug use, because we see it every day. We are very clear on the impact of drug use, not only on a community but on an individual level. And what we are here to do is to love those people and say you are worthy of that love, and take care of them and support them so that they can make the changes in their life that they need. Harm reduction is, to me, really only limited by the climate that it's in, right? And when people get to know us and get to know our program and know that we're not just throwing syringes at people and leaving them to their own devices, that we're providing comprehensive wraparound care to support not just their needs to stay safe while they're using drugs, but their housing needs, their mental health needs, their treatment needs. We're trying to provide a holistic response to this. And really the only limitation to that is funding and support of the community members. And we're really lucky to be in an area that is incredibly supportive. So we kind of see ourselves as the on-ramp. And then once they're in a different place and they don't need our harm reduction resources, we can then hand them off to agencies that are better equipped to help them with their recovery journey.
You definitely want to stay hydrated and keeping the sunblock on.
Yeah, thank y'all.
People deserve the dignity and respect, whether or not they choose to be abstinent or not. They deserve clean supplies. They deserve connection. They deserve love. We don't get to be the judge of that, because you don't realize it saves the person that comes and gets the supplies, but it's also like puts a bubble of safety around their immediate circle as well.
Harm reduction, again, isn't just about throwing syringes at people. It's about building strategies and tactics to use safer so that we can keep people alive so they can get the help they need.
There's more still ahead on Solutionaries, like the fight for access to hormone therapy in Florida, to recovering alcoholics finding comfort in a bar designed for the sober community. We'll be back with more solutions after this. Addiction can be a lifelong battle, and for people struggling to get sober, it comes with plenty of challenges and potential relapses. It's something recovering alcoholics understand better than anyone, which is why a pair of friends in San Antonio came together to create a solution.
The goal of Solutionaries is to highlight the creative answers to problems impacting our communities. When it comes to substance abuse, those answers don't always come easy, but we found people with insight on the issue and solution. However, there are some limitations. Hear what this researcher who studies neuropathways had to say.
There isn't sort of a silver bullet if you want to think about that approach as for treating substance use disorders. Unfortunately, taking abused substance can do is that can rewire your brain in a way so that you will be more likely to seek out the drugs, or cues that you've associated with the drugs are now sort of have more salience or more importance to you. And there is no sort of magic switch that you can sort of turn it off.
In fact, other studies show alcohol abuse can open a door to other dangerous substances.
One of the biggest challenges with substance use disorder is for individuals to remain abstinent from taking the drugs of abuse.
But what if I told you bars could still be a safe place where you could stay sober? All you have to do is mix it up.
Welcome to Hash Vegan Eatery, San Antonio's first and only sober bar. It's a place that serves up vegan comfort food, non-alcoholic drinks, and support for people recovering from addiction.
People who are dealing with addiction have to deal with their heads if they're in recovery and they don't have the drug anymore. The why to open was bigger than just opening up a restaurant. It was to address these things and to give people a place to come and feel safe, feel seen, and feel in a place where there's no triggers.
My demon is definitely alcohol, and I just love the idea of living without alcohol because it's such prominent in my life.
In this 2019 video, Rogelio Sanchez publicly revealed his struggles with addiction and his revelation to help others.
Maybe we just don't need alcohol.
Rogelio and his brother Michael have been sober for almost 10 years. They opened their business as a way to support other people in recovery. And they are not just in the community, but a part of the community.
So we're gonna make the hash daiquiri. The first thing we're gonna do, Liar's non-alcoholic rum, sea-lit citrus, a sea-lip spice, lime juice, CBD infused simple syrup, liquid chlorophyll. This is the hash daiquiri.
For the last 3 years, the brothers have been shaking things up on the city's south side and shattering stigmas around addiction.
I know from just observation on living in this community our whole life, we know that the substance abuse issue, the domestic violence issue, these systemic cultural things that have been either brushed under the rug, ignored for years, or just not talked about.
The Sanchez brothers tell me their mother died from cirrhosis of the liver, which stemmed from alcoholism. However, her life's mantra, to love and give exponentially, lives on in their work.
In doing that, we have seen some just beautiful transformations.
Although the world is full of temptation and triggers, Rogelio and Michael tell me they will continue to forge their own path. And to quote one of their favorite artists,
I drove by the fork in the road and went straight. I don't care what the world had set up for us. You know what I mean? We're here to change the world.
Closer to home, the sober bar movement is alive and well here in Florida. At the Bandbox in Orlando's Lake Ivanhoe Village, bartenders are mixing up an alternative drinking experience with non-alcoholic cocktails and CBD beverages, all with a speakeasy atmosphere. Here in Florida, the transgender community is fighting a different battle. Many adults trying to access hormone therapy and other medical care are worried that a bill in the state legislature will restrict access to those drugs. Solutionaries correspondent Eric Sandoval has more, and just a warning, this story discusses suicidal thoughts.
Tough new laws are being passed in states all across the country, targeting the 1.6 million members of the transgender community. Here in Florida, there are new limits on who can prescribe hormone therapy and who can get it.
They made the decision that they could no longer provide hormone replacement care.
I'm Eric Sandoval, and we're going to show you how some organizations are responding to this problem. We're going to detail how those responses are working and why they admit there's some limitations too.
You can be a part of the solution, absolutely.
First though, we want to introduce you to Justin Trends.
I was pretty young when I knew that I wasn't normal, according to what I had been taught was normal. I remember the very first Google search when I got my first laptop was how to turn into a boy. And I was probably about maybe 14 or 15 at the time. I fought with my parents all the time on wearing dresses and being more feminine and playing dress-ups and stuff. I was extremely depressed for years. I survived several suicide attempts, and I'm very happy that I did. I truly cannot imagine what my life would be like if I had not chosen this path.
But flash forward now.
Yes, now I'm running from my home because it's not safe here anymore.
Wow. So this is your life?
Yes, for the past 7 years, yeah.
What do you think when you look at all this?
Heartbroken.
Why?
You know, I started building a life here, and it just feels like it's being ripped away because there's just, it just doesn't feel safe here in Florida right now.
Now, Justin says that's because in the spring of 2023, Governor Ron DeSantis signed Senate Bill 254 into law. Among other things, it prevents state funds from being used for gender-affirming prescriptions or procedures. It also completely prevents teenagers from starting new transitions. And it also gave medical doctors the only power to write new prescriptions, taking that power away from nurse practitioners. So for you, your solution is to move out of state in order to get your care?
For now, yes.
My name is Joey Knoll. I'm a nurse practitioner. I'm the CEO at Spectrum Health. Spectrum Health is a community-based healthcare clinic. It was kind of my brainchild. This hallway here is our main clinic.
Joey says over the years, more than 4,000 patients have come to Spectrum for care. And that's why he wanted to be a solution for those patients who were impacted by SB 254. So what are you doing to help your patients get the care that they need?
Right, so our existing patients, because we knew this was coming, we planned ahead, we made sure they had plenty of medications, plenty of refills, so that when the legislation was enacted, they wouldn't just fall out of care instantly.
And because there's no medical doctor here, no new prescriptions can be written. And they admit the refills they authorized are not going to last forever.
Are we going to have to bus people to another state? You know, hop on the Spectrum bus. We're heading up to New York so we can get some health care.
Joey says he hopes it won't come to that. Right now, they're working with attorneys and lawmakers trying to get this new law thrown out entirely. But we found another clinic, one that's offering hope across state lines.
Plume is a virtual gender-affirming care service for the trans and gender diverse community. We provide things like gender-affirming hormone therapy, primary care, mental health support, legal and social navigation, all from a virtual platform.
Dr. Jerica Kirkley helped found Plume in 2019. And so far, she says her website and her team have helped 13,000 patients in 45 states, including Florida. Do you see yourselves as a solution to this problem?
We're a solution for sure. You know, it's challenging, and I think it is really hard when we see clinics closing their doors.
But Plume admits their limitations right on their website. They can only prescribe estrogen in some states, not testosterone. And in-person visits can also pose a challenge.
I think it is a solution, but we're, I know a lot of folks on the ground, whether clinicians, advocacy, folks, you know, working to challenge these laws are putting in a lot of work and energy to find other solutions too.
But so far, Plume is a solution for Justin, who's one of their clients.
I want people to realize that we're not after anybody. We just want to be celebrated for being alive and for being people. Like we're your fellow human beings.
But there are limits. And whether it's an in-person clinic or a virtual one, there are some really creative thinkers trying to find solutions for tougher laws.
We are all advocates, and we'll do what we have to do for our patients.
We'll be back with another episode of Solutionaries next week. In the meantime, check out all of the topics we've covered right now on News 6 Plus. Take care.